Bet it is.
And the underbelly of the geese as they come up. You can see it.
It's stained.
Yeah, forever.
Yeah, I'm sure. Uh,
Ready?
We'll go.
Okay, we'll go ahead and call this meeting in order, and we'll start off with the Pledge of Allegiance.
Careful here too.
Hold each other up.
I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Getting closer to
Well,
we're gonna be.
Chewing on it.
Okay, go ahead and roll call, please.
Committee Member Horton,
Here.
Committee Member Grunts,
Here.
Committee Member Knowles,
Here.
Committee Member Jones let me know she'd be absent. Committee Member Schumacher here, Vice Chair Dalton,
Here.
and Chair Ray is still out.
Wanted to reach out to you, correct? You said she wouldn't hear. Okay, first on there is the approval of our last minutes. So if I can get somebody to look through those and then first and second that.
So move to approve them?
I'll second.
All in favor?
Aye.
Opposed? Okay, it passes. The minutes are approved. We have speed readers on this. Pam, I want you to know.
I read them beforehand, so
Thank you,
Same
Dr.
here.
Horton.
you're welcome.
Me too.
Got a medal to give you later on.
Yeah, please do.
Thanks, everyone. Uh,
Not on my
Any
head, though.
public out there anywhere? There must be some public here. We don't have any public out there anymore.
Get somebody? The public does exist out there. They are not online watching this meeting
It's the
currently.
walkie-talkies we was talking about earlier. They'd be online if they're probably hearing it somewhere, so. Okay. Just want to thanks everybody for being here. It's always commendable of those that, are here and share themselves with us. So I appreciate that. And Cicely and Adam for doing what you do as well. Okay, fitness park grant update, old business.
Yes. So last night at the city council meeting, we did bring forward a resolution for city council to commit to funding the fitness park next door. They voted yes. So that was submitted to the National Fitness Campaign. We are probably going to start pouring the concrete pad in July,
Wow.
and they're anticipating ribbon cutting in August or September. So that's very exciting. And
Yes.
there is a significant local match, but staff's already submitted $240,000 in combined grant requests to make up for that local match. So hopefully we'll land at least some of that.
And here we need a little measly $1,250 to finish. What's happening here? Ken, did you get your checkbook out for us? I like honesty. Well, that's awesome, but that's not really old business. That's pretty new. That's great.
Yeah, it's very exciting. They don't have a huge presence in Oregon yet, and where they are is all along I-5. So this is new for them, and it's exciting for us to be the way that they're branching out in Oregon. So we're excited.
Good. I keep thinking, after being on the park board for as long as I did, I keep thinking of east of town all the time. My mind is always thinking out there, how do we make that connection? We have the lake there, but it'd be nice to see something out in there. And I keep thinking of picking Samaritan's back pocket because I know there's a chunk of land out there belongs to them. So it's not out of reach. I did run into Marty the other day. So, so okay. Anything else on fitness parks or anything? Okay. Well, the next item on there on the new business is just the annual report review. It's a slide presentation that I had put together with the help of the members here and their input. And also Wanda Jones, I want to commend her for kind of laying out a format for me, which made that a little easier to put together. I wanted to take the time for us to look at that. And we have that annual report that we need to put out in front of the city council. This is kind of a draft in a sense, but almost seems complete in a way. I don't know, Adam, can you put that up on the screen or not? Or do you not have that you can put that up?
It's in the packet if you want to pull the full packet.
If not, we can just go through the packet too. It doesn't matter. But in your packet, you'll see the blue colored slides. The first one just is a front page, this annual report, who the chair and vice chair is and the committee members. That's a quick one. And then the second slide on that, I just really wanted to reiterate what our mission and our foundational goals were so that, when we come up in front of city council, they'll see what this committee originally was about and our support to the city and our foundational goals. Even though they're goals, they're kind of the building blocks of our additional goals. We kind of feed off that one. It talks about promoting healthy living through innovative partnerships within and outside the community. And if you look at the work that we have done as a committee, we've encompassed those items. Again, the foundation goes to improve our community's health through creative and innovative practices. We're meeting that goal through items like our health fair, our outreach, and our guest speakers we've come in. So, we're feeding and following that. Lead change strategies through education and programs to encourage individuals to take responsibility for the health. Again, we're doing that. We've met with school districts. We've met with healthcare professionals in the different fields out there. We brought them up to the front, and we've done a lot in that part, and to work towards and promote access to healthcare. We're continuing to do that. We still have opportunities out there in front of us to do that. The accomplished parts of that, organized and executed the annual health fair. We've been doing that for we would have been 10 years had it been not for a couple of years with the COVID came in. But, we've been doing that for 8 years, and each year we've always continued to try to bring in new resources. And every year we've been able to accomplish that by either 1 or 2 or 3 or more of those. The coordinated multiple service provider presentations, improving awareness of available community resources, strengthening partnerships with local organizations. And again, we branched over into all of those areas. Suicide prevention presentation, the Rotary Club, we kind of really jumped on that one. We had the guest speaker come in and give that presentation, and we got that one kind of knocked out actually pretty early. Actively participated in community-wide planning sessions. We did that when members of this committee met with the school district when they led the efforts down there, when we were looking at what our government system possibly could do on funding. So, we were actively involved in that process. Prepared and submitted a letter of support to Strawberry Park wetlands. We've done that, and we continue to look for those opportunities, where we can support future projects like that. And on the 2026 goals was provide health committee presentations and education and to the city council. And I think there's the opportunity. I've talked to some other leaders within our community. We talk about city council and involvement, and I think there's one of the biggest gaps we probably have, especially, going down further was, we talked about city council identifying health goals and that, and that's always been an opportunity for us, but it's also been one of the things that we feel we can do a better job at being more transparent, I think, when it comes to helping the city set health goals. And I know in my career, it took me a good 4 years to change a culture of thinking around health. In our company, in Willamette Industries and Weyerhaeuser at the time, there wasn't a lot of health-related managers, and I became one of the first ones. And believe me, it was a hard ride at first, but it took a matter of time of educating employees and leadership itself what the importance of having those types of systems in place. And it took 4 years to change that culture, because they were mindset, why do we need this? Why is it important? And once I started it, like I said, it took me 4 years, and then they caught on to understand the importance of having health-related data in front of them and them owning that. And I think that's the same opportunity we have with the city council, is they're so accustomed to budgets and projects that they don't see. Some of the work they're already doing is health related, clean water, fire and ambulance services,
Parks and Rec.
Parks and Rec, the Greenland spaces we mentioned here, we'd like to expand on, all health related. I just really feel that that's the opportunity we have set in front of us. And it's this committee's job to help bridge that gap and bring them into it, whether they see it or not. I think we can actually make that happen.
Okay, before you leave that one.
Yeah.
Would it be out of line to add "and the community"? Provide health committee presentations and education to city council and the community?
Yeah, well, I mean, definitely.
I mean, to me, that's one of our major
Yeah.
things that we're trying to do.
Yeah.
I don't know, are these open for,
Well, I think some of that kind of falls down under expand public education, the next one down. Because this one, the first one up there is really talking.
I know
city
you're
council.
trying to tie in the city council. I understand
Yeah.
that. I just want to make sure that we're doing those presentations to the community as well.
And the second one down, expand public education. That's those outreach programs, presentations, materials. So there's a bit of a lap.
There is.
Absolutely. What we're going to be doing for educating the community also falls to educating the council as to why we're doing some of those things and why that's relevant to them. And them being in leadership positions is how they can oversee that and kind of influence that from
Sure.
their position. Because the ordinances and policies they set for impact all of that.
The second one satisfies me.
Yeah.
Well,
And I think even if
guy,
it falls down to number 3, where we talk about city council to identify and include health goals. I mean, that's a goal of ours. Now, whether they choose to do that or not, I think even if they choose not to do that, there's still a tie of the importance of this committee and helping guide them in that process. And it's bringing light to that with them. So, I'm not discouraged if we see it or we don't see it. It's an opportunity. It's always been an opportunity in front of this committee of trying to bridge that. And like I said, it goes back to that 4 years. It takes a transition period. This committee being a city committee or an ad hoc committee, our roles are still the same, and I think we can't lose sight of that, what our purpose is. And even educating the community, I think the community probably doesn't see the health committee as a standout committee, and
Do they even know we exist?
not yet.
exactly. And that's that learning curve.
Yeah.
You're trying to learn. And as I told Cicely and Jason, some others, if you look across the United States, you don't see a lot of health committees in cities. They do have them, but they're pretty small because most of them rely on state agencies. We go to DHS, we go to senior disabilities, or we go, that's how they look at healthcare. But it really comes down to how we manage it in our own city. I think that's just my personal thought on it. I think it's relevant. We have a new clinic setting up here east of town. If it wasn't for members on this committee, I don't think it'd be there, honestly, because we poured our heart and soul in that. So making those connections, I think the opportunity is there to strengthen that and bridge that gap. So, I mean, that would be my same spill if I was sitting in front of the city council today, giving that same talk. So they understand the significance of it and the important role they play in that. Increase Sweet Home Community Health Fair attendance. I know when Wanda came to me, she said, we're going to have 1,000 people there this year. And I just kind of flipped backwards and passed out, and she got me back up. But it's something that we've all tried to do, and it's tough. It's selling the importance of what health is in a community. The ones that are attending definitely understand it.
Mhm.
They are a lot of the repeats that come back. But I think we have opportunities there. And I'm glad Wanda's on this committee because she brings that health service side to us. So I think we'll see some things from Samaritan. In fact, I did just, their commitment to the health fair. I received an email last month from Samaritan that they want to donate $1,000 to this health fair.
Good.
Just like that. I met the person last year, first time she attended. I told her our story and she said, I want to sponsor you. So I was amazed that someone like that first time reached out and says, we want to do this. So again, it's for the city council and members like that understand you got a major health service here that has an interest in Sweet Home. That's why we're here. That brings focus to Sweet Home. Now the building relationships with community farmers, that's something that Wanda has a passion is, can we get some sort of vouchers and things from farmers? So that's one she wants to pursue. Can we get their attendance at our health fair? And then enhance marketing through local newspapers, outreach to schools. Again, things that we have been doing, but we want to expand on it. I've already talked to Scott through the newspaper about running health-related stories and kind of bringing more life to that, and he was really on board with that. So I think that's an opportunity. That was just a matter of having a conversation with him,
Yeah.
So, and then the very last one, support fundraising for local health-related initiatives. So what those are, I can't tell you what they are right now, but it's kind of like supporting
Yeah, we
Sicily.
have a sign that's
A sign.
going to help.
So we need to continue, supporting those types of initiatives out there. So,
Mhm.
and that's kind of a slide presentation I felt that would be a good start to throw in front of the city council. It's brief, it's to the point, shouldn't take a lot of time. So at that point, it's kind of like, what's your thoughts? I mean, you already mentioned, Larry, what your thinking was on that. Does any others have yeses or nos or adds or takeaways or good as go or?
I think you'll do
It looks
a
good to
very
me.
good job.
Well, I haven't said who I elected to give that yet. So.
Yeah, well, we have.
That's what I thought. Ken,
Well, unfortunately, last night was the goal setting session for city council. And unfortunately, since our work sessions are always at 5:30, I was planning on being there at 5:30, but it was moved up to 5 o'clock.
Yeah.
So by the time I got there, the goals had already been, posted up. Then we went around and voted on them and stuff. And I mean, we finished up 45 minutes early, but the opportunity to put some things up, I missed it because I wasn't there in time.
Yeah. I couldn't get online.
You couldn't get online, so it's not just me that has those problems. So how to carry this forward into city council? I think the best thing to do is just come the next council meeting to start with. But as far as the goal settings, what's already been selected, with that process, to put the exact language, out of this committee would like to put in there. I don't know how you do that. So,
well, I think maybe just to kind of help support you. I mean, you miss it or you don't miss it. I mean, that we just build upon that. We can't
Yeah.
beat ourselves up too much on that. But I think when I give a presentation to the council, I can reinforce the idea of what we're trying to accomplish.
right. So,
At least that's my take on it. Like I said,
If I might, it appeared under essential services in our memory years ago. And it might be a way to tie in the language as you're talking to them, that we see that as an essential service. You won't break what they've gotten on record now, but it'll give a clue for the future. It was a pretty substantial part of.
well, you see, there's the scorecards up there. That's what it is. So with those, how can I tactfully put it? You can't, each one of those titles, they're about as bureaucracy loaded as you can get. So you can squeeze just about whatever you want in there.
Yeah.
That's my interpretation of it.
That's what I'm saying. It
Yeah.
has been under essential service before.
Yeah, I mean, so
So-
we can just tag it into these things. So
Yeah, there's things there that already exist. It's just
right.
going beyond that into some other areas. And I think throughout the year, regardless of what the goal is set, this committee can come in front of a city council with a proposed goal or idea that we have and get that support. So you're kind of getting the same
Exactly.
thing.
Exactly. I mean, the goals are put out there. That happens every year, and it's kind of redundant. A lot of the same stuff over again.
Mhm.
And what really happens, you progress on these things, but there's that's just the goals. So,
And some of that is, again, tying it into what they're already doing. I mean, maybe they
Yeah.
don't really look at clean water as health related as much as that's a need. We need to make sure people have clean water. But, clean water does
oh,
impact
that's
a great deal of our health.
well, no. I to me, as a counselor and as a citizen of Sweet Home, the most important thing that we do is clean water in, clean water out,
Mhm.
and everything that goes along with it. I mean, for running the city, that's life.
Yeah.
So
Yeah.
it's there. Yeah.
It's there.
In my
like I
mind,
said,
that is
whether
the
they
most important
recognize
thing is
that-
water. So,
I mean, just like what the city did this last year with their city cleanup.
Yeah.
Put the
Yeah.
large containers out there for people that's health related. When
Mhm.
Yeah.
you're getting people to clean up their backyard to get rid of the infestation of bugs and viruses and rats and things, that's pretty health related.
we had a few of those this last year that came before council, and the council was very firm and very strong to
Yeah.
make the problem go away with action. So rather than, I mean, if you got a rat's nest, this council's not putting up with it. It's
Yeah.
going to go away. So
And I think also for us to advocate that this health committee is a resource to them. So if they
Yeah.
don't know, they can come to us and ask. I mean, that's what we're here for.
but that's
Um,
part of the problem last year with the biggest issue we had, and that was the fluoride in the water
mhm.
and how that was handled. Number one, that the public didn't even know hadn't been working for the last.
I mean,
6
I
years.
didn't. I mean, when I read 4 years, I go, what?
Yeah, I just
So-
found out, backtracking and asking a lot of questions. And number two, the consequences.
And it's not saying you can never come back and have those kinds of discussions because you can. It's
Exactly.
you build upon
Exactly.
that,
And I think we should have those discussions because the public did not have an opportunity last year.
and we learn from that and we build on that. That's what we do.
Yes, but councils didn't do anything with the health committee. That was not even, that was 6 people making a decision.
And that's why I kind of put this in this presentation to
Right.
build that relationship with the city council. Because to me, that's part of the missing component. It's kind of like a hidden committee over here. It does they probably understand the health fair. Maybe they don't understand all the others that we actually do on a basis. But anyway, I mean, I look at it as
I
an
started getting in
opportunity.
some trouble here because
Then don't get yourself in trouble.
well, I still get myself in trouble, but there's some very strong opinions on health related issues,
Mhm.
and I'm an extreme minority on the side of health.
Yeah.
What I think is best. So
If I may just add something, when we started the whole thing with the homeless people, there was quite a group of counselors that were adamantly opposed to doing anything to help them or to change the situation. But over time, thanks to some of the members on this committee and a counselor or two, that we started doing some investigating. We went and visited different sites. We found some alternatives. We eventually presented a program to the city council and it's amazing. They
Made it work.
unanimously approved to move forward with it.
So if I may,
So-
what is agendized for this discussion is the annual report review. If we want to delve into policy or procedure conversations, that would need to be added to a future agenda. I just
Yeah.
don't want to get us too off topic here.
No, that's fine. I'm good with that. It's easy to let our passion and emotions build momentum.
And I love that. I just want to follow the law.
Um,
And I think that is following the law, though. It is a goal that we want to present. And that's why we want to do it, because we can impact.
well, I think to Cicely's point, it's the idea of getting off. It's not about the report or what we're doing. It's the additional things that you can dive into that's not on the agenda.
We're not diving into anything that's not on the agenda.
So anyway, duly noted. Anything else on that slide? Does that feel like it's good enough to be presented as is my question.
I would like to, Bob, to come to the next council meeting and just present.
Well, is that the goal setting time?
So goal setting is a work session. Your presentation would be during the regular session at
And when-
6:30.
When
So
you
the
see
next-
that probably,
The next two meetings, we have one on Tuesday, March 10th. Sometimes we cancel the second one in March due to spring break. We haven't had that discussion yet, but I'm happy to put you on for March 10th, or we can circle back about the 24th when I know more.
let me look at my calendar because I got to look at what I'm going.
Yeah,
to do.
absolutely. Just let me know.
And, we'll
It's
figure
easy
it
to
out, but
throw
yeah,
you on
we
there.
we'll move it into where like I said, if this group feels good with this, then I
Mhm.
say we put it on the agenda and we go
Yeah, absolutely.
and don't look back.
Move forward.
Don't look in the rearview mirror. We've already been there. We just got to look forward with that. So
Move
I think just
forward.
being present is important.
yeah.
Just keep it in
And-
front. Keep
And
it
I
in front
would
of
have been
council.
at the other one. I guess I was misunderstanding what I needed to be there or not about what this committee had put together as a resource list for them and their goal setting. I wished I would have had that opportunity, but again, it's a missed opportunity, but it's what it is. And, we can't fault ourselves for that. We just build up on that. So
So-
it's what it is. So, that's that part of it. I guess we're moving along fairly quick. Are there any other items we need to put on this agenda? I mean, I have one I'll just talk briefly about, but I'll wait till the others have their input. Shirley, you have anything or?
I volunteer at Shem. So I've observed that lunches have changed at the high school. And that's healthy because it's healthy eating, but more salads, more fresh fruits and things like that I didn't notice before because we're getting the surplus at Shem to be able to hand out to the community. But I think that's a change in the school lunch program, and I'm
No.
not sure, but it's,
No, we have had salad bars at every school for probably 15 years.
okay. Well, just it's something
Maybe
new
even
that-
more than that. 'Cause
Maybe
I've been
they've been-
retired for 10 and I know they've probably been in there for 20 some odd years.
maybe they've been just throwing it away. I don't know. When at the end of the school day.
You'd like to think they've been eating it, but
Well, you should see how much we get.
well, I know.
Okay, so anyway, that was my question is if, health wise, if we have changed the diet in the schools, because that was something that
No,
the
but
federal
I
government
think the
wanted.
feds are coming out with some new regulations
they are.
because of our person in charge of health throughout the whole country. I think there are some changes that are coming. Not for sure what they are.
Mhm.
I'll just leave it at that.
Okay,
But yes, there are changes
You
coming.
did
to
such a
the-
fine job. You were
That was well
professional
done.
there.
Thank
Like
you.
you said.
yes, did very well.
Just learn to expect the unexpected. I mean, that's life.
Yeah, that's
Yeah,
life.
That's life. How about you, Mike? Things are graded. I know with you already said that.
No.
Except you have state regulations, I understand, that are being thrown at you that will change the landscape.
It's always changing.
He has a big dinner coming up in a
We
couple
do.
of weeks.
Yep.
Hopefully everyone's aware of that.
Fundraiser coming up.
Tell us about it a little bit. Is it a big fundraiser? It's your big annual fundraiser?
It's a major.
fundraiser. Chris King, is working really hard. Working really hard on it.
Okay, fundraiser where?
It's going to be at the Boys and Girls Club. And we're going to have, baskets there, silent auction, music, raising, money for, repairing the floor there. Actually, we're in the process of doing it. We have a big donation that's happening there. And we're also doing a gun raffle. And I'm just looking to involve anybody in the community that wants to come out and support us.
Yeah, I know you, well, I was involved in the past when I was
Yeah.
on the board, but yeah, it's for a good cause. So
Well, and Casa de Reyes is providing the food.
Correct.
And they have donated, I guess, all of the food and the service. So
Awesome.
Yep. We're getting great support from the community.
And this is March 7th, right?
Yes.
And what time's it start?
I believe it is 7.
That sounds awful late.
yeah, I think it's before that. 5:30 is what I'm thinking.
I know
but-
Tricia's in charge of this stuff.
Yeah, I'd have
oh
to.
yeah, blame it on someone.
No, she knows everything. She's
5 to 8 p.m.
Oh, 5.
5 to 8.
Okay, got it.
I better make sure that's on my calendar.
Look at that.
so I don't
I
miss it.
strongly encourage everyone to be there.
Yeah.
Good entertainment, good food.
We
good
will be
music,
there.
Good stuff. And a
Thank
good,
you.
and the price is reasonable. I think it's
Thank you. I appreciate that.
$15 a ticket.
20 bucks,
Price.
$15 for seniors.
15, yeah.
That's a bargain. Today's prices on
So
some.
you're going to pay that much if you go to Casa de Reyes for dinner.
Anyway,
So, yeah, good deal.
Yeah, I went somewhere the other day. Someone bought me lunch, but it was like $16 for the hamburger, and I could have might as well eat my boot. You know, it was that delicious. They thought it was great, but I thought I could make better hamburgers than that. So, what about you, Dick? You got anything going on?
no,
Many meetings you go to all the time?
this is well done. This is
Okay.
well done.
We'll be there to support you though, Coach.
We
Yes, we
support
will.
me. I didn't say I announced yet.
Well,
Then we'll just.
you're the acting president. What can we say?
She's going to be back any minute. I can feel it coming.
Yeah, well, I doubt it. I think she's waiting until you get
Well,
done with
yeah.
I
this.
think maybe that's what it is. She's holding off until that gets out of the way, and
She did
then
it
she'll
last
come back.
year.
Yeah. Well, I've stayed in touch with her. She's still doing good, and of course, doing household work while the little one's napping. So
Yeah.
I must not be running a vacuum cleaner, I'm sure. But
Are you going to have a baby so you don't have to do it next year?
well, I
Oh,
tell you,
sorry.
if I
Moving
do,
on to the next one.
then you better buy tickets to that event. All I can say, it's a good fundraiser. But
What time's the city council meeting? Again, just to remind me.
6:30.
6:30.
And it would be nice if as many of us as possible
that's
could
why I
be
was
there.
asking.
Yeah,
Throw me to the wolves. You know,
never happen.
I can handle.
We have your back.
I can handle it.
We have your back.
Okay. Well, the only thing I was just going to kind of report out to is for future thought is this committee itself and how we operate. I think it's good for us to touch back to ourselves. And it's kind of like, what do we want to be when we grow up and how that looks? So I think it's just something we go back and retouch on that base a little bit. At one time we were an ad hoc and then we become city and, we could be anything. And look at how many times we meet a year and all those things to do what we can do most effective, but also help support the city leadership here in what they're doing and how they're doing it. So I think that's our responsibility.
I have, I've talked with Angie Fredericks, who is in charge of the diabetic program at Samaritan in Lebanon.
Mhm.
And she said that she would be more than willing to come up to Sweet Home and present to us or to anyone that we would want her to present to. It'd either be her or one of her staff members. But
What's your name again? I'm sorry.
Angie Fredericks. I think it's Fredericks.
And again, she oversees.
She oversees the diabetic department at Lebanon Hospital.
Okay.
And
Sure.
diabetes is one of the programs, I think, in our community that needs some help because we have a lot of diabetics in our community.
We do.
Yeah, I had her, she helped me coordinate having a nutritionist come out to the senior center
Very good.
twice. And unfortunately, we didn't have a very good showing and it was well advertised. So I felt bad for the dietitians that did come out to talk.
Right.
But I'm always willing to try it again.
And again, when you talk health related, if it affects the person, that's the person that's probably going to show up. So,
Mhm. Yeah.
and timing and everything is critical
Yeah.
on a lot of these things,
I
but
tried to do it before lunch on Wednesday because I knew I
Yeah,
might have
you'd
some
have a good
takers.
turnout, maybe.
That's what I was hoping.
Well, according to Angie, Samaritan is making some progress as far as moving diabetic services into Sweet Home.
Mhm.
Up till now, you've had to go to Lebanon Hospital.
Yeah.
And I believe she said that it was in the works. I don't know exactly when it was going to happen, but more diabetic services will be available in Sweet Home soon
yeah.
at the clinic.
And I talked quite a bit with the clinic and the staff up there, and they got lots of rooms, and that's one of the things they are is filling those rooms with different services. I mean, I was surprised this time. My wife, like I've shared openly, about my wife going through her depression and anxiety. I mean, we both talk about it out loud because it's important to talk about those things
Yeah, it
out loud, not hide them in the closet. And, we're connected back to this clinic up here of some behavior help and
Good.
psychiatrists and that. So it was nice to know that we didn't end up having to go to Corvallis to seek that sort of support. It's been a long journey, and I think that's the thing I find about some of these services like mental health and others. It's such a long journey to get from point A to point B.
Right.
And if you don't know how to navigate that, that's tough. And I know even Wanda, I mean, I think up there, she talks about one of the hardest things they have is transportation. And I thought transportation was pretty well taken care of in Sweet Home. And she said a lot of people just don't know how to navigate just that simple system, so.
So do you feel like I should try and schedule her for one of our meetings?
Well, yeah, talk to me and we'll play back and forth. Yeah, I think
Okay.
it'd be good to have her come up here.
Yeah,
Absolutely. It's an
especially since
opportunity.
there's a transition coming that is going to impact our community
And
in a positive way.
exactly. No, I support that 100%. I
Okay.
think the rest of this group supports that
Yes,
as well.
absolutely.
Okay,
Yeah,
I
I'll do
will.
that.
Let's shoot for next meeting then.
Okay.
Unless you have other things on the agenda.
I always have other things, but
All right, I'll see if she is available.
Dick keeps the leash on me and pulls me back a little bit.
I know he does, and that's a good thing.
Kim, you had something to say, or
Oh,
I can see a wheel turning there and I'm thinking,
well, I was just thinking about, transportation, which I did for, 12 years here. And one of the things that I always found frustrating and still find it frustrating, although it's not my problem now, it was the services were available. And it's like, I don't get at how people cannot know that we have a bus system and we have demand service,
Yeah.
all these things that comes to your door, it's a buck.
Yeah.
We have the shopper that runs all around town, and we have the shuttle systems going, all these things, and like,
How do you get the word out?
yeah, I really don't know.
You're in the paper, you talk, it's like,
I know. I
it's
think
just like,
it comes down to how people interpret that from what I'm understanding with Wanda, because she said that, a bus service will bring a client and drop them off on the curb. And the poor client doesn't know to go from where to there after that. It seems more transportation,
that's what
but
the
I'm
service
not sure.
type
But
thing.
like I
But
said,
it's one of those things where I think like that there, the connection to the medical
Yeah.
service providers. I mean,
it's how the pass off. I
yeah,
understand.
I mean, but that's, kind of this disconnect. It's like nobody really cares about that within the building. It's about, we provide the service for the medical attention.
Yeah.
But the transportation is there. It's
Yeah.
I mean,
We could beat that up another hour too.
it's just one of those points of frustration
Sure.
where maybe where it's coming back from the other side, where the medical community is actually Well,
It's
maybe
just-
that should be something that part of our training, that everybody there at least has a 30-minute training session on public transit and all the services that.
And I think that's kind of what Wanda's getting at is,
Yeah.
as a goal for us, how can we help move that needle?
Yeah.
It's just that, so. Yeah. Okay, anybody else have any other thing? Because I know we're cruising through this meeting and these people probably said, "God, look at Bobby's cruising," so.
We're gonna be out of here.
Anything else?
So speaking of the next meeting, I will not be here. I will be out of state. So if you want me to pick another staff liaison, I can do that. Or if you want to skip to April, whatever you want to do is fine.
Chime
with
right
us.
in on the screen.
I will be in Texas eating very fine barbecue. I'm so
Okay.
sorry. Yeah.
My brother lives in Texas and we still talk. I mean. So
Not if you have a.
we'll figure it out.
Okay,
Touch
we'll
base
connect.
with it.
Okay.
All right, nothing any,
Please let me know before I schedule Angie if we're not going to have a meeting.
yeah, we'll do. Thank you everyone for being here.
Hey, thanks for getting it done early.